West Bengal. Mamata was actually one of the first adopter of Ayushman Bharat. I met her in Delhi, explained to her why this makes sense and how much state is going to benefit. And she already had a scheme called Swasthya Sathi scheme. So she agreed. But what will be surprising was there were two BJP ruled states which said no.
When I was going through your details, so you did your IIT, then went into administrative services and did an IAS, then you went on to become a health economist.
Sanitation Community Health Project. One of the key aim of that project was to eradicate something called Guinea Worm. Guinea Worm is a medieval type of disease where you get a long worm, which is like a spaghetti, under your skin. So it was a very challenging project, and that's where my journey into health started.
Help us understand what is Ayushman Bharat.
Ayushman Bharat, one of the most important health sector initiative government has taken. The basic brief was right now because of expenditure on health, many people fall into poverty and government should take care of that.
You used to get interaction directly with Modi ji?
Yes, many times. He is such a sharp person. Before you tell him what you want to say, he already understands what the question is. And when he speaks to you, it looks like he has care for like this discussion, nothing else. I'm sure if he sees me now, I've not met him for 4 years, but he'll remember me because he has a extremely sharp memory.
Thank you, Mr. Bhushan, for being here.
Thank you for inviting me.
Quite a pleasure. I have been wanting to speak with someone who has played a transformative role from a public health perspective and in healthcare, especially from the government angle as well. You've been the founding CEO for Ayushman Bharat, and we will go and talk about that a lot as well. But you seem to be an engineer who hacked healthcare. That's when I was going through your details. So you did your IIT, then went into administrative services and did an IAS. और यहाँ तक तो ठीक है, चलो बात फिर भी समझ में आ रही है. Then you went on to become a health economist, and please help us understand your journey a bit.
You know, it's very true that the life has been actually pulling me into health sector from various other things I was doing. I never thought that I would become an IS officer. I never thought I would leave it. And I never thought that after 30 years, I'll come back to India, health sector, government, and doing the same thing that I would have done if I have not left the IAS. You know, it's a long story. I come from small towns. My father was in UP electricity board. He was an engineer. He was first person out of his village, and so he did quite well. And my life was not.
Where were you born?
I was born in Lucknow.
Lucknow.
I'm from UP, and my whole family, almost whole family is from UP. And so I was born in Lucknow, and he was transferred every 2 or 3 years. So I was going around mostly in eastern UP. And that's where I would see, my father was executive engineer, superintending engineer, but people who were running the shots in those small towns were IS officers. Oh. So when my father wanted me to become an engineer, so I did become an engineer. But because of my upbringing, I always wanted to also become an IS officer. My father was also very keen that I should become an IS officer. And so after my BTech, I was a gold medalist, and I got several offers. But my father told me, no, don't take these offers. You should prepare for IAS. So I joined IIT Delhi. And so I was, of course, studying, but also preparing. I was too young at that time.
So even at the time of getting into IIT, you wanted to be and were clear that you will pursue IAS.
Yes.
Oh, okay. And, is that unusual or common in IIT?
Well, it was becoming quite common at that time. A lot of IIT graduates wanted to become IAS officers. And that was because of a change that UPSC did in 1979 when they allowed engineering subjects to be also included in the IAS exam.
Oh, is it?
Yeah, before that, it was largely people coming from history background or humanities, and
Right.
maybe some from science backgrounds, but there were no engineering courses at that time. So papers, engineering papers. So for example, I took electrical engineering as one of my subjects, and physics, which is very
So
close
there
to
is an electrical engineering subject in IIS.
IAS exam, yeah, UPSC exam.
Oh, lovely. Oh, I
Yeah.
didn't knew that
So
till
and that
now.
changed in
Oh, yeah.
'79, and so because of that, a lot of IT graduates and engineers started coming to IAS. So I came to the IAS in '83. Uh, First time I was lucky to get into the IAS, and I'm from UP, and I was lucky to also get UP cadre. So when at that time anyone asked me that, what is your future ambition, I said, I'll just stay here and
Yeah.
become collector, and then maybe secretary and chief secretary, or I'll be in because ISA officers in their home cadre have a different perspective on life,
Yeah.
because you are very influential and your family loves it. You also find it very very interesting. uh, but life changed, at that time, as you can imagine, IAS officers also command a lot of premium in marriage market.
Yes, of course. I
So
think still they do.
yeah, and so I would remember that a lot of these CVs and proposals from all over would come for me, and somehow none of them stuck. And so that also changed my life, because I met my wife in Masuri,
Okay.
and she was also in the IAS,
Oh, wow.
and
Okay.
so same batch, and
There must be very few female IS at that time, or
very, very few,
yeah.
Now I think they're about 20, 30, 40%.
Yeah, now I
But
think
at that time, maybe 5%. I think there were only 10 out of the batch of 150. So we met, and
she was in the same batch.
same batch,
Oh,
and we decided to get married. And she was in Rajasthan cadre. So that actually created a bit of a problem, because by virtue of marriage, she couldn't come to UP because UP was her home cadre too. And although she didn't want to work in UP because she didn't opt for UP, she opted for UP, she would have got UP. But she wanted to be in a more peaceful, quote unquote, peaceful state. So she opted for Rajasthan, and she was in Rajasthan. So we got married, and for 2 years we continued to work with the system that if she could come to UP, but that was denied. And then ultimately I went to Rajasthan.
Rajasthan.
And Rajasthan, my first posting was in Kota, which I really enjoyed. And then they put me to some UNICEF projects called Sanitation, Water and Community Health Project.
Okay.
And that's where my journey into health started.
Okay.
And when they put me
When
there,
was this?
that was in 86, 87,
86,
86.
So sanitation project.
Sanitation project. It's called Sanitation Community Health Project.
Okay.
And the one of the key aim of that project was to eradicate something called Guinea worm. Guinea worm is a very medieval type of disease where you get a long worm, which is like
Yeah.
a spaghetti, under your skin. And it is not there anymore. We have eradicated that successfully. But at that time, it was quite
It was a
prevalent.
prevalent one.
And so it was a very challenging project. But I was from this IAS mindset, and I was really upset. That's मैंने तो IAS कलेक्टर बनने के लिए ज्वाइन किया था, मुझको कहाँ ये इसमें डाल दिया इन्होंने. So I went there kicking and screaming, but of course when I went there, I really enjoyed it. I it
Tell us more about
yeah.
what the project was and what
Yeah.
were you supposed to do.
Yeah.
And,
So it was a project in 3 tribal districts of Rajasthan. It was based, the headquarters was in Udaipur, which is a beautiful place, of course.
yeah, lovely.
And but Dungarpur and Banswara, these are 2 districts. So in
Yeah,
these 3
I've heard
districts,
about them.
there's a large tribal population, and the source of drinking water, even at that time, was largely step wells.
Right.
So what happens is that when you go into step wells, your feet also go to step wells. And this cycle is like this, that once you have Guinea worm creates some opening in your legs. And so when your legs are in the water, they release larvae. And those larvae ultimately become anyone who drinking that water also gets into the system, and then it perpetuates. So the way you can break the cycle is by not having water from step wells, or strain the water, or break the cycle by. So we were installing hand pumps. We were trying to close step wells, and there was a huge focus on education.
So the solution is to close the step wells.
See, the closing the step well was being done for 50 years. But closing the step well was not leading to this exact solution, because you close it, next day they'll open it, because they need water.
They need water.
And
exactly. You need to give them an alternate source of water.
And in many places they installed hand pumps, but sometimes hand pumps wouldn't work. And so as soon as hand pumps didn't work, they would go back to step wells. So it was a losing battle.
Yeah.
So here there was had to be some education about why we are closing step wells and why it is bad for them. Second was that greater emphasis on maintenance of hand pumps. Educating local people, and especially local women, on how to maintain hand pumps, and also having a system that hand pumps don't go out of order, so that they don't go back to step wells. And also, if they're taking water from step wells, don't step inside water. Things like those. So, and you won't believe that in 1 year's time, the prevalence of Guinea worm came down by 90%.
Wow.
With that. And then we, of course, had these awards that if you can, anyone who reports any Guinea worm will get 1,000 rupees, which was a big money during those days. And of course, we had treatment of Guinea worm as well. We had some doctors who could take out Guinea worm, like they could make a small surgery and they could take out the Guinea worm. That is also a good intervention. So I was there, and while I was there, I would always crave that, I want to be a collector. I want to do a job which is more mainstream IAS job. I'm no
and
one.
What was your notion of what is the mainstream IAS
Like
job?
being a collector, being a commissioner, being in the secretary government
of a city or something
city,
like that.
And those are the jobs that people associate IAS with, right? And this is something that technical people do, right? So, but I was really enjoying it. So then whenever I would meet my chief secretary, Mr. VBL Mathur, I would say, sir, I would like to do something mainstream. So he posted me to one district in Dausa, where I went. And don't get me wrong, being collector is also very fulfilling. You can do a lot of work, and I was really
what part
enjoy.
What part of this job were you enjoying really? What made you enjoy it? Let me put it.
I'm going to be very frank that when I joined IAS, when I was aspiring to become IAS officer, I was not doing it to say service to the nation or welfare. I was more attracted by the glamour and the pomp and show and the power
of it.
And I would see in each district headquarters, the biggest house belonged to the collector, and he was the chief guest in all the functions, and he had a pilot car, and those are things as a kid I was attracted to. But when I became the an IAS officer, I liked actually much more the kind of work you could do, influence the people life of people, and if you are doing small things like I used to, as a collector, stay in the night in villages, small villages, especially remote villages, and I would get land records rectified, and long pending disputes, which are not disputes at all. They just wanted some, say, division of land holdings, and you do that, and they are so grateful because those things have been pending for a long time. People are asking for money, and I think many of these things just come out. So it was really very fulfilling in terms of just being able to help people. And at that time, I said, I'm but missing the health sector. I'm this is all very good, and but
You
I'm
still
not.
like that the
Yeah,
community health
yeah, because
experience
so
much
I
more.
used to just think that that's my calling, because that's where I could maybe make more difference. So I said, why don't I just go and do some degree, because I'm an engineer, I'm an IS officer, but I don't know much about health. So why don't I do a degree and learn about health
This was at
formally?
what stage of your career?
About 7, 8 years.
7, 8 years you were holding an IS office,
Yes, yeah.
some
So
role.
I'm 83 batch. So I started thinking about that about 1991, and I left in 92.
That's a big decision, isn't it?
It's a huge decision because
What
see
what went
first.
through that? What tell us a
So
little more on the your personal dynamics
uh,
and thinking at that time, as well as your reaction
mm,
of family. What was your wife
mm,
also was doing?
yeah,
I'm sure some roles similar to yours
yeah.
in her
So
eyes.
so
So tell us a little more about.
yeah. So my family was really upset when I moved from UP to Rajasthan, because they thought that we have IAS बच्चा हमारे साथ in
यूपी में रहे.
UP में, और he'll be helpful in like you have that kind of prestige that
Yeah, yeah, of
you
course.
have a
Of course,
IAS
of course.
son in the
And you're
family in
staying
the state,
together,
right?
and yeah, yeah.
And many things just happen because you are. So they were really very upset, and one could understand why. And then when I was thinking about going abroad, I was at that time thinking only for going abroad for 1 or 2 years and just learning and coming back and working. That was my
You can take a leave from
yeah,
IS for that. Yeah.
yeah. So you can take leave up to 5 years,
Oh,
and
lovely.
and
That's
for 3 years, government pays for it. Yeah.
oh
So
wow, nice.
government will pay your salary, and of course, if you don't come back, then you have to repay the salary to the
But
government.
they do pay 3 years
Yeah.
salary for.
Yeah. So government of India actually is very generous in terms of letting officers invest in themselves, and so it was.
Nice.
So, and those were the days when we didn't have internet.
Yeah.
So, finding out which is the best college, it's you need to go to libraries and
But
do
the
that.
thought was you want to learn more about healthcare because you want to really invest in going in healthcare.
Yeah.
But wasn't a simple option getting into health ministry or something like that, or health secretary, because you are an IS
Yeah, but
officer?
I was actually but junior level at that time, and so I had not come to government of India, and so I was working in states government, and I wanted to get some academic grounding,
Grounding.
because I thought that I should learn what other countries have done for improving their health system. How could what are the different analytical frameworks in terms of analyzing what is the problem,
Yeah.
and monitoring what is being done. So I wanted to learn and also learn from the best. So I applied to many places, Harvard, and actually application fee itself was very
Yeah.
expensive, and in that was equivalent to my, say, 1 week's job salary. And but I applied to 3 places and I got admission in 3 places. And one of my favorites at that time, there was a fellow called Everett Rogers. He's written about diffusion of innovations. He's a big person in communication, and he was in USC, University of Southern
Yeah.
California, LA.
Yeah.
And I was in touch with him, and he wanted me to come there. And actually, he had met me also once in India. and I was also in touch with Johns Hopkins University, and they also wanted me to come there. So they gave me admission, but none of them gave me funding. And so, at that time, after 9 years of service, my entire saving was about 1 lakh or 1.5 lakh rupees. And as you
This
know,
was
that
in 1990.
91, yeah,
91.
91. And I had a car, and that car was also given by my father, because my father had told me that when if I become IAS officer, he
He'll
would
get
give me a car. So he gave me a Maruti 800, which actually at that time was cost 56,000
Yeah. Right.
rupees. Yeah.
Something like
So, but 56,000, and but there was some premium. So even after running it for 8-9 years, I could sell it for more. So including that car, I had about 2.5 lakhs or something, entire money. So I sold my car.
Oh, you did?
Yeah, because in
So you couldn't get funding at all?
no. So they were telling me that you come here, and then something
look
can be
at it.
worked out. But
You don't know
funding
that,
for
right?
masters, they told me, was almost not available. But if you come for PhD, it is feasible. But I didn't want to go for PhD. I just wanted to go for a couple of years and
Yeah.
just do masters and come back. That was the whole idea. And but even after selling all those, that money was enough only for my airfare and one term out of 4 terms. So for 3 months. So I did that, and I converted. I still remember that I was sending my PS. I was collector Dosa, which is next to Jaipur. So I gave him the bank draft of all the money I had and told him to go to RBI office in Jaipur and get me dollars.
Dollars.
He was looking at me. He said, "Sir, are you sure you're doing the right thing? You're putting all your savings into this. Do you think this education is going to give you any returns?" And he was astounded that, this fellow is a collector and has so much going for him, and he is just leaving and going to some study. Like couldn't understand.
Wait,
So I
was your family able to?
yeah. So my wife was okay with it, but she was not. We had by then 2 children also,
Yeah.
and the idea was that I'll go just alone because she was
The main earner now.
she also had a job, and she
Exactly.
couldn't just up and leave. So it was not a easy decision. Amit,
Yeah.
it was a little bit.
I can understand. I did something similar.
Yeah,
And when I
my
went
kids
to
were
do my second master's in London Business School,
okay.
and I was in GE at that time.
Yeah.
I was a general manager.
Uh-huh.
I was doing extremely well.
Uh-huh.
And everyone around me, and for right reasons, were not able to understand why you need this.
Yes.
So you are in a very good company. You are in a very good position. You have
Yeah.
a wife and 2 kids,
Yeah.
very similar. And what makes you do this, and what is going to happen because you did this LBS? Because you already have one master's. It's not that you don't have, right? I'm going again for a master's. It was in leadership and strategy.
Okay.
In London Business School, and it was a full 1-year residential program, and I had the same, and that's why I'm so curious on what you went through. And my family was like, "Why do you need this?" Right?
See,
And everyone, I'm very right.
I was just let me give you the macro picture first.
Yeah.
As soon as my life has started to settle down, I have almost unsettled it, because
Yeah.
I was in UP, all well set, and people were happy, family was happy, and I up and moved to Rajasthan. In Rajasthan, earlier I was not happy because of, but then I was really doing well, quite happy. Then I decided to leave and go to the US. US, I started to work in the World Bank in Washington, D.C., and my wife also was working in Washington, D.C.
Your
And,
wife was working in Washington.
she also later joined, and she was also in the World Bank.
Oh, really? Oh, really?
So-
Okay. So let's.
Let me give you the
yeah.
macro picture. So Both of us were working in the World Bank for a couple of years. And then I got this offer from Asian Development Bank, which is based in Manila, which was much more attractive. And so I left that and went to Manila and joined Asian Development Bank. And there I was there for 21 years, and I became Director General. So I was a senior most staff in Asian Development Bank. And then everything was fine. We had a lovely house, swimming pool, and good career. I was doing quite well in Asian Development Bank. And then the call came from Prime Minister's office that they would like me to come and establish Ayushman Bharat. And I upped and left that job in a whisk, like a just in a moment's thing that, okay, we are sure. And within 3 days, I was here in Delhi.
We're very keen to
Yeah.
understand Ayushman
Yeah.
Bharat. So the PMO office called you
Yeah.
and they
It
gave
was,
a brief.
it was very funny. Uh, I was looking after East Asia for ADB,
Yeah.
and that was Sunday. I remember very clearly Sunday in March, and I was on my treadmill next to, and my phone was ringing, and I was saying, in ADB usually people don't call you on Sundays.
You were in Philippines that time.
Yeah, Manila.
Manila.
And so I asked my wife to see who's calling. He said someone from India, is an India number. Then I said, oh, maybe my parents or someone. So because a call from India is important. So I stopped and I picked it up, and it was from PMO, some joint secretary. And he was saying that, sir, can you come to Delhi tomorrow? Like we are looking at you. If you
So
would
you had
be-
no idea before that?
Yeah,
of
no. So he gave me the background, and so I said, yeah, I'll be very happy, but I can't come tomorrow because I'm going to China tomorrow, and I have meetings lined up and for next 2-3 days. He said maybe on the way back from China. I said, but of course between China and India is not on the route, but I'll make a detour and come. But only thing is that my meetings finish on Friday, so it has to be. So there's no problem. We work on Saturdays too, and so you can come to Saturday. So the next Saturday, in morning I land up in India, and I go straight to PMO, and so this joint secretary, Mr. Navneet, Brajendra Navneet, he had a chat with me for about 15 minutes. He said, come, the principal secretary would like to have a discussion with you. So I go to principal secretary's place, and principal secretary, I kid you not, spoke to me for about 10 minutes. And then I said, fine. So
He told you to run this. What
Ah.
was the brief given?
no brief. He just asked me about what I've done, what is my background, and things like those. And then he said, fine, go. I came out. I asked the joint secretary that now what is the next step? Like, am I getting this job, or because I have to plan.
Hmm.
And he says, I can't say anything. It's PMO, principal secretary, and PM has to decide. I said, so why did you call me? Because
Yeah.
I came on my own, spending my own money.
Oh, you spend your money to
Yes.
The government didn't.
No. So
What
So-
are you saying? Oh my God.
so I said, I was really cheesed off. They called me here. They talked to me for about 10 minutes, and then don't tell me what the next steps
Yeah,
are.
I'm surprised. Wouldn't they pay for
Yeah.
getting you?
So
there?
I go back, and of course doing my own things, and then I sent an email to this joint secretary with some questions that what is the process you are following, what are the job content, what is the level of job, blah blah, 4 or 5
Right.
questions that I had in my mind. I did not hear back from him for 2 days. Then I was thinking maybe they're not serious, and so I sent another message to Brajen that looks like you're too busy, but this decision has serious implications for me, both professionally and on personal level.
But
Uh,
was he saying you need to take this decision because they have not even
no, no,
communicated?
no, no. Yeah, this if their decision would have implications,
Yeah,
whatever,
yeah,
yes or
yeah,
no.
yeah.
So I respectfully, and since maybe you're not clear about these things, so I respectfully withdraw my interest.
From
And thank you. Within a couple of hours, his phone came. He says, "Sir, I saw that email, but I had not seen the previous email. And if you have questions, you should send me WhatsApp because that's what I see. And tell me what you want to ask." Uh,
okay.
so asked those questions, and he responded. He says, "System is being your name is being discussed, but we don't know where it
The
is."
outcome.
But next day, Mr. Nipin Mishra called me. The phone came to the in ADB, some senior person that I want to talk to Indu Bhushan. They didn't have my number, I think. So they connected, and so Nipin Mishra said, Indu, I've discussed it with the Prime Minister, and
And Nipin Mishra is the principal secretary.
yeah, and he would like you to join, but we don't have your application, so we can't start the file. So
Can you
can you
apply?
can you send an application? So he said. Uh, so I said, tell me, sir, what I should write. He dictated the thing. I wrote that on email and sent it to him by email. And I must say that when government wants to do something,
They do.
within 3 days' time, the my thing was done. ACC, this Appointments Committee of Cabinet, who had to approve it, which has Prime Minister, Home Minister, and one more minister. So they approved it, and they called me back. Then now approval is done. Uh, we want you here next day. I said, I've I've been here for 21 years. I'm heading a department. I can't come tomorrow.
They want you to join tomorrow.
Join tomorrow.
How is that possible?
And I also have to give 1 month's notice.
Yeah. How was ADB about it? I mean,
ADB
they,
was very upset
yeah,
to begin with because
obviously.
they thought I was being disloyal, that leaving. But the president also realized and acknowledged that it was a big honor, that they're inviting you back to
lead a
lead a very important flagship scheme. So he was also very happy about that one of their staff is being recognized for this kind of work. So of course, Government of India probably also spoke to him that we want him there. So I left ADB in 3 days' time, not next day. In
wow.
3 days' time, I was here.
So now help us understand what is it. So I don't think
Mm,
everyone
mm,
still, right? And for that matter, even I probably I don't
mm,
know how much I understand. I
mm,
do, of course, to an extent. I'm in the healthcare, but
mm,
help us understand what is Ayushman Bharat.
mm.
Right, and
You
what
know,
was the brief for you,
mm,
and then what actually happened,
mm,
and the challenges, we will come to that, and the learnings from it.
mm.
But what was Ayushman Bharat all about?
You know, Ayushman Bharat, uh, I would say, is one of the most important health sector initiative that government has taken, and both in terms of potential impact and reach, and actually it impacts not only people but the whole system, and I'll come to that later. But the basic brief was that PM keeps saying and has repeated it many times is that right now, because of expenditure on health, many people fall into poverty, and we should not have anyone who is deprived of quality health care because of lack of financial resources. And they or no one should become poor or poorer because of health expenditure, and government should take care of that, and they should have access to both public sector and private sector best services, which will be paid for by the government. So that was also enshrined in the cabinet note, uh, maybe about 10 pages. 10 pages of cabinet note, and they had appointed one IS officer who was my deputy CEO, and they had given me one PA. So there were three of us from the government to implement a scheme which was going to be working with 36 states and UTs, getting about 30,000 hospitals on board, and providing this support to more than 50 crore, 500 million people. And scheme of that complexity started with these three people and 10 page of note. And so, of course, PM had made very clear that he wants to announce and launch the scheme on 15th of August. And partly,
You used to get interaction directly with Modi ji?
yes, many times.
Huh?
Many,
Yeah.
many
So
times.
what's your experience like?
Oh, I like he is such a sharp person. You know, before you tell him what you want to say, he already understands what your question is. And he's and we've had meetings which is running into late night about 12, and he's as sharp, bright, and fresh as probably he's just gotten up. And at his age, he's about more than 10 years older than me, but the kind of energy that this guy
Yeah.
has is remarkable. And not only energy, but also the mental sharpness is, and I mean, people don't reach the place
Yeah.
that he has reached without
Just like that. Yeah.
that kind of um intelligence and people connect.
Right.
And I've had meetings with others. I have one-on-one meetings like you and I are meeting, and when he speaks to you, it looks like that he has care for like this discussion, nothing else.
Yeah.
It's not that when he's talking to you, he's thinking about something else. He will go deeper into it. I have a lot of respect for that, and his memory is
Very
tremendous.
good.
I'm sure that mm, if he sees me now, I've not met him for 4 years. I met him once after I left, but and he'll remember me because he has a extremely sharp memory. Both faces and names he can.
Was
Yeah.
incredible. So
So,
his message always was, and of course the ministry message as well as
mm.
his message was that it's primarily. Is it right to say that Ayushman Bharat is primarily an insurance cover for poor for healthcare, or is it much more than that?
So, see, Ayushman Bharat, the scheme, the part I was implementing, Pradhan Mantri Jan Arogya Yojana, is for treatment, tertiary, secondary treatment, where uh, there's a catastrophic health expenditure. So, anything which requires treatment or
Admission, hospital admission.
hospital admission. So either through insurance using private sector or public sector health insurance companies, or as we would call assurance that government will provide those. So sometimes you don't want to engage a health insurance company. Uh, you can create a trust, and the
Yeah.
trust can pay for
So
it.
how does it work? So
Yeah.
that's probably the question. How does this
Mm.
scheme work
Yeah.
from its supply side as well as from its demand side? Like who enrolls in it? What is the process,
Mm.
and how is it fulfilled?
You know, these were all questions when we started the
Started,
scheme
yeah.
because if you have 10-page
Note.
of note and just this vision that 500 million 50 crore
Crore people have
people
to-
are going to be covered for anything which is catastrophic, then obviously there are many questions.
Exactly.
One is that who are these 500 million people?
Exactly.
How do we
them?
identify them? What kind of services will be covered? Who will provide them? How much we are going to pay for them? How we are going to pay for them? Health insurance and trust,
Right.
and how are we going to monitor? how are we going to have fraud prevention and
Detection
abuse
of
of
this money.
money. And so one thing which we decided was that we'll have to have a very robust IT platform,
Right.
because if you are going to be implementing this scheme of this scale for
Digital infrastructure
so
is very.
it has to be based on a digital infrastructure platform. This platform should be able to recognize, identify the beneficiary. This platform should also record what was the initial diagnosis, what was the treatment prescribed, and it should track the treatment. If the person is there for 3 days, what different procedures or medicines were given, and then after that, this platform should be able to raise the bill, and through platform itself, the money should be paid back to the hospital. And
Wow.
all the hospitals who want to be impaneled should also register themselves on this platform. So one platform had to be created.
Right. So
And
your first step was to create that
yeah,
platform.
that platform, and creating that in 6 months time, and ensuring that it works, the beta version was, and then doing it, all the glitches need to be resolved. That was done, and I must say, uh,
So you
I
hired some IT infrastructure.
so there were some
Yeah.
some mm, top-notch volunteers who were working with me, but the person who helped me with this is called Mr. J. Satyanarayana, and Mr. J. Satyanarayana used to be IT secretary. He's an IS officer, retired IS officer, and he's been involved in almost every big IT project that country has done, including
Okay. So he's
e-passport,
the
and
one who just knows the IT stuff
he
there.
knows the IT like back of his hands, but also he's very diligent, very humble, and uh, he
Knows how to get
I
this executed as
yeah.
well.
So I approached him that, sir, I want you to be our advisor. He said, Indu, I don't want to be advisor. I want to do it. I want to go into the kitchen and make
Wow.
sure that because I know that advisors provide advice. Sometimes you take those advice, and sometimes you don't. And I don't want my advice to be ignored. And so
Wow.
I want to lead the whole thing. I said, sir, neki or pooch pooch. अगर आप
That's
if you
such
have
a
that kind of time, he said, and I'll do it, and I'll do it only for 1 rupee per year.
seriously.
Yeah, he didn't. He said, "I'll not take any money. I'll just do it for the country." And
Wow.
hats off to Mr. Satyanarayana.
These are the unsung heroes
Yeah,
actually, right?
he was devoting probably to the scheme. And we see our whole team
Yeah.
was working probably 9 to 9, about 12 hours a day, and Saturday, Sunday included. No Diwali, Holi, nothing. Because within 6 months' time we had to roll this out.
Yeah.
And so creating this IT platform,
How big was the team?
we started with two,
Yeah.
like I was saying.
That's why I was wondering
Yeah.
how do you do this?
Then uh, in the cabinet note, the team of about 69 was all the different positions were there. But I realized that creating the position and employing people in government is not that
Will
easy.
take the 6 months away actually.
Not 6 months, about 3 years.
Yeah.
Because then for each of them you have to have recruitment rules,
Right.
and recruitment rules are approved by UPSC, because
Wow.
and then after
Oh, is that?
yeah,
Okay.
and after recruitment rules are approved, then Ministry of Finance has to agree for those, and then it takes a long, and then you have to advertise.
And how did you go about?
So I didn't have a choice that, like, I couldn't wait for these
Exactly.
79 people to come. So first of all, I started this beg, borrow, steal thing that. So I approached all these international development agencies: World Bank, ADB, GIZ, Bill and Melinda Gates Foundation, and I told them I need support. I need these skills, and I need tomorrow.
Right.
And I need big PMU for IT, like, because I had to create
right.
this. and
And so that's how you got
so
the
so the
IT
so
delivered platform.
IT and
But
many
then you
other
also had the other part, right? To
other part
understand.
for information, education, communication, for monitoring, evaluation, for other things.
How to identify these people? What should
So
be the
and
amount? How did you go about that?
so we had about within and then we asked for some volunteers.
Right.
So some volunteers also joined, and all these big four companies, this PwC, EY, they actually quote unquote loaned us people pro bono, because first of all they wanted to contribute to this scheme, and they wanted to learn, but also it was also in their business interest, because once the scheme was
Yeah,
up
you
and
have a better
going,
understanding of
and
that.
they probably were
Yes.
looking for future business, right?
Exactly, knowledge.
So they gave a lot of people free. Then we also asked some IAS officers and government officers who were working in states whether they wanted to come, and many states actually loaned those officers to us. So now we had a team, good team within about 3 weeks of about I would say 60, 70 people. But we didn't have space, because we had just 2 rooms in a Ministry of Health, and those 2 rooms were like to house these 50 people. So we had Ministry of Health was also very helpful, and they allowed us to use their meeting rooms to as our offices. But of course, those meeting rooms were also needed quite frequently. So we would see that all these people are just going around in corridors, and or many of them would come and sit in my room, and my deputy, his name was Dinesh Arora, his room. A lot of people would be sitting there, and but it was only weekends, Saturday, Sundays, then we would have all these rooms to ourselves, and we would feel really good. There was a saying in those days that on Saturday, on the weekends, it was only NHA people and monkeys in Nirman Bhavan. So that was tough. But there were many challenges in establishing the scheme. You had to have rules of the game ready. Like, how are we going to impanel hospitals? Like, what kind of criteria we would use? What kind of services are going to be covered? Which packages? Which health conditions? How much we are going to pay for it? And all the mm, bidding documents for how do you engage these insurance companies, and so on and so forth. About like several scores of such
Yeah.
guidelines need to be prepared. Training, we had to engage all those people who are going to be implementing it. So training those people would be needed, right, in
Yeah.
6 months' time. Uh,
Where was the
then IT.
fund for this coming?
Funds were fine. We The money was never a problem with Ayushman Bharat. We were it was
No, not for implementing it, not for the office, I'm
yeah,
saying,
but even
for example, for 50 million, 50 crore people, you're saying, for 50 crore taking care of healthcare needs, there has to be some fund for it to go.
Yeah.
That was allocated.
that money was allocated. That was not the problem.
Okay.
And establishing these rules of the game was also not the problem. One big problem was how to convince states to be onboarded,
Okay.
because as you know that in our constitution,
Health is a state subject.
health is a state subject.
Yeah.
Although Ayushman Bharat, we are paying 60% from central and 40% comes from state. States have to agree, and I thought that such a welfare-oriented scheme, which is has proven to be successful in like say a state like Andhra Pradesh, where there is Arogyashri, which was
Obviously.
which actually helped the CM to come back, because people say that he became more popular because of that scheme. So uh, I thought that all the states will be very keen to
But they
adopt
were
it.
not.
So yeah, that came as a surprise.
Why would that
Partly,
be?
there were many factors. See, most of the BJP states were fine because, of course, it
It was
was,
a more a mandate.
yeah, it was, and they could see the clear, both from welfare perspective, also political
Political
perspective,
person.
and as I mentioned earlier, elections were coming.
Yeah.
2019
So it
was
helped them.
general election, and that is why I think it is not written anywhere, but the push to started
Started in
in
time was there,
2018
of course.
was also partly because the elections were coming,
Fair enough.
which is fair. You
Yeah.
know, it's a great scheme, and
Why
so
not?
if you can
Yeah.
get some political mileage out of it, why not?
Yeah.
So, no problem. So, most of the BJP states, not all. I'll come to some states which were not were okay. Most of the non-BJP states, and at that time there were many,
Yeah, yeah.
uh,
Exactly.
and were not.
Because they saw this as a win for BJP and not for
Yes, yes,
themselves.
yes, yes. West Bengal, Mamata Banerjee was actually one of the first adopter of Ayushman Bharat.
Oh,
I met her.
really?
I met her in Delhi,
Okay.
and I had a pitch that,
Staunch opposition,
yes,
right? A staunch
staunch
opposition.
opposition,
Yeah.
2018, and she I explained to her why this makes sense and how much state is going to benefit. And she already had a scheme called Swasthya Sathi scheme, and so she agreed, and she called the chief secretary and said, "Talk to Dr. Bhushan."
What made her agree?
And she thought it was good for the state and it's going to help the state and people, and and we signed the MOU with the government of West Bengal, started the scheme, and it was doing really well because the system was used to implementing similar scheme. It was like a brownfield state. We used to call brownfield because
Some kind of scheme used to
yeah,
be there
in some
already.
states there was no scheme, so those are greenfield state, and we had
Oh,
different
there's no-
strategy there because you have
Yeah.
to build the
How
system.
many states were brownfield and how many were
About
greenfield?
50-50.
50-50.
50-50, and so greenfield states we had a different strategy. Brownfield state, it was basically the convergence, so whatever they were
So
doing,
Arogyashri was there, so
yes,
there's obviously some
exactly,
brownfield.
exactly.
You don't
And
need
so
any.
West Bengal also brownfield state, beautiful scheme, and they had some really good systems going. We were also learning from
Learning from.
West Bengal. Then the elections were announced in 2019, and the PM Modi sent letters, personal letters, to each family in Bangla with his picture, uh, welcoming them to Ayushman Bharat and
For
telling
those who
were
registered
beneficiaries.
for.
No,
Beneficiaries. Okay.
beneficiaries. One, I'll tell you
Yeah.
how we selected beneficiaries. So he sent about 40 lakhs letters
Wow.
to in Bangla.
40 lakhs only in Bangla.
Only in Bangla. Otherwise, several
Much more.
crores were sent in Bangla to these people with his picture. He's sitting down on a table and writing the letter, and a nice picture. And that created a real political storm because, I got a call from the chief secretary saying that, sir, this is a scheme which is 60% by you, but we are
40%.
putting 40%. How come our chief minister's picture is not there? And you should have consulted us before sending this letter
Fair enough.
because
Yeah.
this is our scheme too. And I tried to defend, saying that this is a national scheme, and we are sending actually not only in West Bengal but the entire
Everywhere.
country. We have sent these letters. Uh, he was, of course, not convinced, and they just decided to withdraw. They're saying that you have made this scheme political, and actually elections were coming up, of course, and so in 2 or 3 days' time, they sent back 170 crore check to me that this is your money, just take it, and we are
Wow.
off Ayushman Bharat, and so they left. Uh, but other states, they continued, and they saw the benefit of being part of Ayushman Bharat, both in terms of getting money, but also technical advice that we were giving, but also interconnectivity with other states. So it was they continued, and now, frankly, um, only West Bengal is the only state right now which is not part of the scheme. Every other state, all 35
In a way, they
states
felt
in
let
UT,
down.
they felt that
Let
that
down.
so
So if the political mileage was not an issue, it would have still continued,
yeah,
isn't
well,
it?
they joined, and then they
They were the
joined.
first one to join.
They
So
were among the first ones to join, and there were others actually who also resisted it for the long time. One was Odisha, and I met Chief Minister Naveen Patnaik twice, and I made the same presentation to him in terms of what is in it for states to why should they join. And so he was listening he had a very deep English accent, and he said, I said, sir, by not joining, a state is going to lose about 800 crores per year. He said, Dr. Bhushan, I am prepared to lose 800 crores, but I'm not prepared to lose the elections. So he was seeing it more in political
political
terms.
terms.
He says, we have a scheme which is running well, and I think we don't need Ayushman Bharat. And we try to convince him that, I realize that you have a scheme, but the scheme can become much better, and you will get 800 crores
Yeah.
extra.
So, but you know what? At the sound of at the risk of sounding controversial, right? If the center doesn't take a political mileage out of it, isn't it easier to execute?
Yeah, it will be. And I think, we are living in a democracy, and politics is part of democracy. And there are things which are good about politics, because, many of these schemes came because of politics, and then these are good schemes, right? So, yes, you're right. But what will be surprising to you was there were two BJP ruled states
Which said no.
which said no.
Why was that?
One was Rajasthan and one was Maharashtra.
Maharashtra. Oh, because
Maharashtra,
they had their own brownfield.
both of them had their own scheme. Rajasthan had something called Bhamasha Yojana, Bhamasha,
Okay.
and they were extremely proud of that scheme, and they thought that it was also correct that people knew about that scheme, and they didn't want to dilute it by calling it Ayushman Bharat or changing
Which is fair
the
enough.
character. And at that time, the CM was Vasundhara Raje, and my sense was that she was also not on good terms with
Right.
um, some of the
Her
key
personal
key
equity
leaders.
would have lost if.
Yeah, and so she was running the state as a more independent CM, and she didn't want to join.
And might be that scheme is more associated with her, and you're
Yeah.
kind of in a way diluting
Exactly,
that.
exactly.
Right?
And
So-
she saw that scheme as her baby, and she didn't want to maybe give it up for something which was coming from nationally. And I remember she called me at 11 o'clock in the night one day and said, Indu ji, आप तो राजस्थान के हैं, आप जरा पीएम साहब को समझाइए कि हमारी स्कीम बड़ी अच्छी चल रही है, इसको हम लोग डिस्टर्ब नहीं करना चाहते हैं. तो मैंने कहा कि
And नहीं किया फिर they didn't.
नहीं किया.
किया.
तो मैंने कहा कि मैडम ये मेरे पे ग्रेड के ऊपर है. आप मेरी हिम्मत नहीं है कि मैं पीएम साहब को कुछ, मैं वैसे भी मैं मिलता नहीं हूँ साहब उनसे. तो आप ही कह सकती हैं.
Yeah.
तो I must tell you the PM used to review this scheme very regularly. So there is a platform called Pragati. It's called proactive governance and
Yeah, yeah, I've read somewhere. Yeah,
implementation
yeah, yeah, yeah.
and targeted implementation. Pragati is the
Yes.
acronym, and that Pragati, he I think does it every 2 or 3 months, and where all the chief secretaries of the states and all the major or the key related secretaries attend that meeting, and there is a fixed agenda, and on that very clear decisions are taken. So we had Ayushman Bharat in 3 or 4 Pragatis, and one of the Pragati was there, and I made a presentation, and I said these are the states who have not joined. So obviously,
It was political
Maharashtra,
maneuvering for
Maharashtra and Rajasthan.
Maharashtra. Why I was
Same thing. They also had their own scheme. Bapu Bafule.
yeah, there is one. Yeah.
Yeah, yeah. So they had their own scheme, so which they didn't want to again dilute. And so both of the chief secretaries mumbled about they're doing well, and PM said was very angry, and they told them go back and tell your chief ministers that I want you to join within a week or something like that. So he was saying that these excuses, he said something like that. He was very impatient with both chief secretaries, and of course they had to fall in line. And he also had messages to other non-BJP government chief secretaries that you guys don't seem to be serious about supporting your own people, and so obviously it was impactful. So what I was saying.
So now today there's only one state in the entire country
West Bengal.
which is not West Bengal is not on Ayushman Bharat.
Yeah.
All others are on Ayushman Bharat.
Yeah, everyone came for the longest time. It was only West Bengal, Odisha, and Delhi who were not part of it. Delhi, AAP government, in every budget they would say that they would going to join, join Ayushman Bharat, but they did not. On political reasons, they would always make some excuse, and but of course, once BJP has come back both in Odisha and Delhi, so they've joined.
Yeah.
West Bengal is still holding out, and they are the island. I think probably doesn't make sense for them not to implement the scheme. It's a national scheme. It's serving a lot of people. And I can tell you right now, every day, about 1 lakh treatments are being given in the scheme. About more than 3 crore treatments every year. So, if you'd asked me when I started it in 2018, that in 7 years' time, your scheme is going to be providing 1 lakh treatment every year.
It gives 1 lakh treatments a day.
A day.
And how much money that would mean? It has to.
I don't have exact figures, but probably state and central government together are putting in about 30 crores per year.
30 crore per year for the entire
scheme, yeah.
For the year?
Yeah.
That's enough?
Well, for the time being, it's enough, 3 crore times...
30 crore of insurance premium.
Yeah.
And then the insurance companies are taking care of all of that. There was one more thing, right? So I come from a healthcare background, right? And so you mostly deal with private hospitals and stuff like that. It's quite tough to empanel because the rates that Ayushman Bharat, and that's another difficult area. How do you decide what should be the rates, right? And the rates that were given by Ayushman Bharat for private hospitals, right? Sometimes that challenged the profitability for them, or at least according to them. The second big challenge they used to have is they have made these hospitals for a certain socio-economic people, and if you're delivering the same care at very two different price points, it's very difficult to justify that, right? Yeah. There is a perceptual issue. So how did these hospitals participate? And what was
I
it
think
that
both of
made
your questions are related in a way.
Yeah.
Hospitals were up against arms on the rates from day one, and in all meetings, in all big conferences done by industry associations, the main question they would ask me about was the rate. And that was the main point of contention in the discussion.
How did you come on those
Yeah.
rates? Yeah.
So, and I, so the concerns were twofold. One was that these rates become like a water point benchmark, and as you're saying that if government of India thinks that this procedure, this surgery should should be priced at 5,000 rupees, and then when they put that same procedure for say 50,000 or 20,000 or 25,000, how do they justify it, right? And they were concerned about that. It's going to be optics of this will be very difficult. Second was, of course, they said that the rates that we are putting in are not viable, and they will not be able to provide quality treatment following those rates. And they would say that maybe the rates have been made based on marginal cost, like incremental cost, but not average cost, because we have to also take care of many of the fixed costs, because
Exactly.
how will the expansion of the hospitals take place? How are we going to be putting more capital investment? And for that, we need some buffer. So it's not only incremental cost. The problem that we had was that there was no data which was reliable. We asked the industry to provide data which, and the data that industry provided was very biased, and of course biased upwards. And so of course we didn't, but we had information from government hospitals, and based on that, those rates were given. And frankly, for most procedures, those rates were actually uh, very well within the like viable range, and in some cases, actually, they were more than the viable range, but not all of them. So, well, collectively, private hospitals never accepted those rates, but individually, many of them um, did accept, and but their contention was that it's okay, we are okay with this rate so long as you pay us on time. And but with these rates, if you don't pay us on time, then obviously even high rates if you don't
Does it
pay us on
happen?
time.
Is it getting paid time or?
I'm hearing more and more that a lot of bills are pending,
Yeah.
and there is, by one estimate, about more than 5,000 crores worth of
No, that's a big
bills are.
challenge to the healthcare industry
Yeah,
in a
it
way.
is, because uh, that takes away their running cost, and it's
Yeah.
uh, and financing cost is a real cost, right?
Right.
Because right now seeking money from
Yeah, yeah, yeah.
the market, about 5 to 10%, of course, at a
Exactly.
minimum, a conservative rate, right?
Yeah, yeah.
So I think the if we can ensure timely payment, then most of the hospitals, I'm not talking about top end corporate hospitals, but most of other private hospitals will be okay. And as you can see, already proof of the pudding is in eating, right? Right now, out of 30,000 hospitals which are impaneled, about 14,000 are private sector hospitals. And if you look at the most of the tertiary care, most about 70 to 80% of those tertiary care treatments are being provided by the private sector hospitals
70 to 80% are
of
provided.
tertiary care. Yeah. So, obviously, there are hospitals which find these rates viable. They're providing those treatment, and
So, the last bit, I mean, this is interesting really, is
hmm,
what are, say, 2 to 3 big learning, and some of it you have already told, but what
hmm,
are the 2 to 3 big learnings that you have
hmm,
from the Ayushman Bharat design and execution
hmm.
so far, right? What are the things that went well? What are the things that you think you learned, right, and people should take those learnings who are carrying it forward? How do you see this outcome I'm not sure whether we have done any study yet to see what, because of this Ayushman Bharat, the impact on Indian healthcare has been so far. But what are your gut feelings on what happened? What is the outcome that has gone beyond, just providing for the poor, of course, but how has this impacted the overall Indian health industry, as the number of
Amit,
people going to poverty less and all
I
of that?
must tell you that already we see a lot of things which have changed the health system because of Ayushman Bharat.
What would be the top
And
top two to three?
I used to always say that if we implement this scheme well, then healthcare in healthcare we would know healthcare in India by before Ayushman Bharat and after Ayushman Bharat, and so Ayushman Bharat, of course, uh, provided these treatments to millions of crores of people and prevented them from going into poverty and encourage them to seek early treatment. And I think there are studies. There's a study which has been published in Lancet, which shows that people who are on Ayushman Bharat, they tend to have early treatment of cancer, which of course leads to better outcomes. But more than that, what is happening is that Ayushman Bharat has helped in digitizing the health system because of this IT platform. Now, all these crores of treatment that we are providing are all digital in the sense that they are
Data is available for
data
that.
is available. It has helped in terms of deepening the concept of health insurance because uh, health system in India was is based on traditionally was based on out of pocket.
Yeah.
Hospitals want the money and then they provide services. They are not used to, they are not comfortable with the idea of providing services and seeking money much later, either from the government or from health insurance company, right? But this helped them in terms of actually deepen that concept of health insurance. Now, even hospitals in tier 2, tier 3 cities are looking at this as a
So number of
viable
people penetrated under insurance cover has gone up. Do you have any numbers on that or no?
Many times. Actually,
Yeah.
now it's about 70-80%, because of Ayushman Bharat. I have a paper which is coming up in EPW, Economic and Political Weekly, which should be coming in next month's time.
Okay.
Month's time.
Wow.
We show it very clearly that Ayushman Bharat has helped in terms of deepening the health insurance and also the concept of health insurance become more
Lovely.
acceptable. Third thing which has happened is that now there's been some green shoots. You see so much investment in health
Right.
system right now, right? And tier 2, tier 3 cities, which didn't have good health system, lot of private investment is going there. Why? Because earlier, private sector did not see any demand. Because those
The demand has increased because of
people,
this.
people didn't have the paying capacity.
Yeah.
Now someone is paying for them, so there's a demand for these services. And so a lot of new chains, new hospitals are coming up in tier 2, tier 3 cities because of Ayushman Bharat. You see all these equity funds being very interested in hospital sector. Partly
Yeah.
the reason is that they see demand. And I was in a conference and head of this cardiology association from Gujarat, he told me that one thing Ayushman Bharat has done is that expanded number of surgeries, so surgeons. And he was saying that earlier for heart surgery, there were about 12 surgeons in Gujarat because it was being done in 2 or 3 places. Now, since it's being done at so many places, and the number of surgeons who can do heart surgery has multiplied by many times. So this what I'm saying is the supply of so there's a supply
Impact as well, because demand is being created.
because
So
once you create demand, supply
people
also
will
fills
find
in.
ways to supply.
So in terms of number of people who can provide those services, number of hospitals, number of beds in private sector, all that is increasing because of this. So I'm hoping that because of this digitizing, because of insurance becoming more acceptable, so that So pooling of risk. And what other thing is also happening, Amit, is that these schemes are also getting broader and deeper. So we started with the SECC, we changed from SECC to other parts of identifying poor people. Then certain kind of workers were added, like ASHA workers,
Right.
Anganwadi workers, and they were added.
Lovely.
Then everyone above 70, because they are very vulnerable.
Everyone, is it?
Everyone.
So,
Everyone.
irrespective of what the
Irrespective of their economic status, so long as you are above 70, you are part of Ayushman Bharat.
that's big, right?
So-
That's
so
great.
that's it.
yeah.
And now they will be further step, probably everyone with the disability
Yeah.
should be added, and I think that will happen. So similarly, what I'm saying is that the scope of this scheme has been
And
increasing.
this card is given or the government
By-
identifies as people, everyone
was-
above 70 just gets the
if you-
card.
Yeah, absolutely. There's it's a
So the card finds you. You don't have to find the card.
yeah, exactly,
Right? In a way.
exactly.
And-
And some states have made it universal, like everyone.
Yeah.
Like Jammu Kashmir, the scheme is universal.
Oh.
And there are other states also, like Himachal Pradesh, Uttarakhand. The number of people have increased almost to 100%. So slowly we are going towards that concept of universal health coverage, where everyone should be able to have access to quality care
But one of
without being put to financial hardships.
Yeah, but tell me, one of the reasons we don't have a universal health coverage, right, is because as a country we were not able to afford it.
Yeah.
How does this? Where does the money for this come through?
Yeah.
If for the government it's a challenge, right? Come through to
That's a
fund this
fallacy.
something.
That's a fallacy, Amit, because in India, government spends the least amount of money on health,
Very less,
which is
yes.
1.2% of
Absolutely,
GDP.
absolutely.
And it is recent years it increased to 1.3, 1.4. And in our own national health policy of 2017, we said that by 2025, which is this year, we'll increase it to 2.5% of GDP. We are about 60% of that. And
So we don't spend as much as we
Yeah.
have, even.
yeah, so
even despite
which we
this.
had committed.
Yeah.
And 1% of GDP is about 2 lakh crores, And so right now, even if we don't reach 2.5, if we reach 2% of GDP, we can run Ayushman Bharat or
It's a big fallacy you're saying. We don't have a
other
problem
schemes.
of money.
So we have not problem of money, but a problem of prioritization.
Right.
And I am big one for supporting infrastructure.
Yes.
One road, 1 kilometer of road cost about 50 crore rupees, right?
Yes.
When all these highways, we should be having all those, but we are making thousands of kilometers of road. So we can also do health.
Yeah. Health is also an infrastructure.
Exactly.
And it's like-
See, the concept has the health is an investment, and if we are going to Viksit Bharat 2047, it can't happen without good education and good health.
Absolutely.
You can't have unhealthy people taking you to
Absolutely.
new heights.
Absolutely.
For a developed country, the first fundamental thing is that education and health should be
So there is this Abha ID that has come.
Yeah, so
is this a
that's-
part of Ayushman Bharat?
No.
Or is it different?
So Abha ID is a digital
Mission.
ID.
Huh.
Yeah. So each, and that was also started by me.
Is it?
So
Okay.
we started at that time National Digital Health Mission,
Yes.
and the idea was to provide digital health infrastructure so that everyone has an ID. Everyone also, every hospital has an ID, and every provider has an ID, unique ID, and so that people can have these longitudinal records from
Exactly.
cradle to grave, and which helps you in terms of going to a doctor without those thick files, and all of these things are digital, which are either cell phone or on the cloud, and the doctor can see with your permission or consent what kind of vaccines you've taken, what kind of treatment you've taken, what kind of
So
diagnostic
people
text.
don't know
Yeah.
probably that this is something that they can use,
So
and
no,
why should they use
yeah,
it? And
exactly. So that is getting a little bit less traction because uh, people, of course, can see benefit of this, but hospitals
are not
uh,
able to see.
are not seeing that kind of benefit, especially if it's becoming interoperable.
Right.
So right now, hospitals want to keep their data and record with themselves,
They're not comfortable to
and they're
do
not
trust.
comfortable sharing it with other
Yeah.
hospitals and outside. So I think that has to
So
be
yeah. So
broken.
probably my last question, right? We are in the world of AI
Mm.
and blah blah blah, and right, AI
Mm.
is a big thing,
Mm.
and it's possibly yes, right?
Yes.
I've seen
Yeah,
AI.
yeah, absolutely.
It
AI is
is.
already changing
Now
the way we
you,
operate in the health
in
sector.
a way, you
Mm.
have created a digital infrastructure of public health in
Mm.
India from an insurance route.
Mm.
Uh, what do you see the future as overall from the public health perspective and India's role, government's role as well as private health role? India is a very private healthcare driven kind of. So how do you see this converging, especially in the context of AI?
Well,
And
mm.
what do you see are the 2 to 3 things that people who've probably come in your place now should do to make
Well,
this possible?
we were using AI even in 2000, starting in 2018, not Gen AI, but normal AI,
Yeah.
for fraud detection and abuse detection. We had more than 100 algorithms that we were running for all the claims which were being put
Wow.
to see whether those claims make sense. For example, person with the age of 20 coming for cataract. It is possible, but highly unlikely. If people from the same family going to the same hospital very frequently
Yeah.
for seeking certain kind of treatment which should not be coming together.
Yes.
Uh, there's certain things which
So
happen
those
with age.
algorithms are put in
Yeah,
place.
yeah.
It's
So we would run all of them
wow.
through those algorithms, and we had hired SAS to do that for us. And based on that, we would have flags, red flags for stop the thing, green for maybe it looks like some coding error, just have a
Yeah.
look. Yellow where
Yeah.
some inquiry has to be done, and we would send it to all the states that these are the claims which sound suspicious, and based on their feedback on those, we were learning. So there was also machine learning part going on, that we change those algorithms or refine it or have new algorithms made. So that was being done. So in preventing fraud and abuse, preventing malpractices, AI can help in a big
Big
way.
way.
And looking at, say, some doctors who are prescribing too much, say, antibiotics, and sending or asking for certain kind of diagnostic tests which are not needed. AI can help in a big way in
Yeah.
identifying those people
Yeah.
who are misusing the system, right?
Yeah.
But more than that, other thing we did with AI at that time was looking at the pattern of disease, especially when
Exactly. I mean, you're getting a lot of data. Is there a
about
possibility that
about a terabyte of data
yeah,
every week,
private entrepreneurial
Yeah.
participation uses data to build new AI?
Yeah,
Do
exactly.
you see
If we
something
have to
like that?
create our LLMs,
Exactly. Yeah.
we have to train them on our own data because our systems are
Do you
different.
see such discussions happening
Oh
or
yeah, absolutely.
yeah?
The ICMR has created a subgroup, actually committee, to look at how we can harness our own data because we have huge amount of data. It's like water everywhere, but not a drop to drink.
Yeah.
And so, how to harness all this data in a way which also takes care of the privacy and security, but we can also use it for training our own LLMs. So, I think that will happen, and probably in terms of AI, we've been behind the West and China, and hopefully we'll catch
Okay.
up with the AI mission and the emphasis that PM Modi now has on AI. So hopefully,
Super. I think on that note, I think the future
yeah,
probably is AI Ayushman
yes,
Bharat.
yes.
And thank you so much for being here. It was
I,
wonderful to talk to you.
I really enjoyed talking to you, Amit, and thank you for inviting me again.
Thank you
Thank
so
you.
much.